Hello everyone, welcome to sqadia.com. My name is Saima Mushtaq and our today's topic of obstetrics is medical complications of pregnancy. In this lecture, we will talk about the different medical conditions that can complicate the pregnancy and what are the effects of those diseases on the pregnancy and how the pregnancy will affect the diseases. So in the first section, we will talk about the respiratory diseases. What are the warning signs of pneumonia and what's asthma and how it affects the pregnancy, and also the effect of cystic fibrosis. In the second section, we will talk about different haematological abnormalities, in which we will talk mainly about the sickle cell anemia, thalassemia, and thrombocytopenia. And then also we will talk about bleeding and inherited coagulation disorders. Then in the third section, we will talk about the gastroenterology disorders and peptic ulcer disease, celiac disease, and also inflammatory bowel disease and pancreatitis. In the fourth section, then we will talk about some liver diseases that can complicate pregnancy, like viral and autoimmune hepatitis, gallstones and primary biliary cirrhosis, and also we will talk about the cirrhosis as well. Then in the fifth and final section of our lecture, we will talk about skin and connective tissue diseases, in which mainly we will talk about SLE or systemic lupus erythematosus. Then we will talk about scleroderma and some other skin diseases that can complicate pregnancy. So very interesting topic. All these different medical conditions that can complicate pregnancy will be discussed in our today's lecture topic. So keep watching sqadia.com to learn more about this topic. Thank you.